Hello ladies and gentlemen. Welcome to Dr. Vet channel. Come to the livestock world. Fascioliasis is a common disease in buffaloes and cows. The disease often makes them weak, debilitated, slow to grow, and reduces productivity. Therefore, it greatly affects the efficiency of farming. So farmers should pay attention to proactively preventing diseases to achieve high efficiency. Join us to learn about this disease and how to prevent and treat it in today's video. Fascioliasis is a quietly common disease in buffaloes and cows. The disease is caused by Fasciola gigantica and Fasciola hepatica parasitic in the liver and bile. The disease often makes them weak, debilitated, slow to grow, and reduces productivity. They can be infected with Fasciola all year and occur in all ages. Therefore, it greatly affects livestock efficiency. Fasciola gigantica, flat body, leaf-shaped, red-brown color. There are two suckers, oral one and abdominal one. Fasciola hepatica, shape and color similar to the above species, but shorter, with two bulging shoulders behind the head. Life cycle of liver flukes. Adult liver flukes lay eggs in the feces. When encountering favorable conditions, warm, having water, they will develop into parasitic larvae in freshwater snails, then develop into juveniles, and emerge from the snail. When it is outside, it will lose its tail and turn into a cocoon, also known as an infected larva, which will float freely and cling to aquatic plants. When cattle eats vegetables containing infected larvae, the cocoon membrane decomposes and releases the larvae upon entering the host's body. The larvae continue to move to the bile duct, stay there and develop to the adult stage. The time from when a buffalo or cow swallows a cocoon until it becomes an adult fluke is about 3 months. An adult can live in the liver's bile ducts for about 3 to 11 years. 11 years. When cattle are infected with liver flukes, they often have the following symptoms. Chronic form. Cattle are emaciated, weak, anemic, and have prolonged diarrhea, causing them to gradually lose their plowing ability and fertility. They can die from exhaustion. Acute form. Sick cattle stop eating, have bloating, then have severe diarrhea, thin gray feces with a fishy smell. After a few days of illness, they lie flat, cannot walk, and die from dehydration and exhaustion. This disease is often found in calves under 6 months of age, due to secondary infection with pathogenic bacteria present in the stomach and intestines such as Salmonella, E. coli. To prevent disease, you need to do a good job of veterinary hygiene and disinfection of cages. Kill pathogens in the natural environment. Compost to kill liver fluke eggs, and periodically deworm animals twice a year. People can use one of the following medications. Use albinol 100 oral, or aldazole for oral administration, or mix Levosol 200 WS for cattle. Or inject Fluconix 340, or Lever 100 or Intermectin Super. Dosage according to manufacturer's instructions. At the same time, there are measures to kill snails that are intermediate hosts for transmitting this disease, such as using copper sulfate at a concentration of 3 to 4 to spray on grasslands and aquatic plants to kill snails. Cutting off the development stage of the disease in the larval stage, or raise ducks and fish to kill snails. When cutting grass for cattle to eat, do not cut the part that is submerged in water. Grass cut from low-lying or flooded areas needs to be washed. Do not graze cattle in swamps, canal banks, ditches, or stagnant water areas. For newly introduced cattle and buffalo, it is necessary to control food and water sources well, and do not graze freely in heavily infected areas to avoid the risk of liver fluke infection. Deworming should be done for newly imported cattle before raising them. Take good care and nourish buffaloes and cows to improve body weight and resistance to liver fluke and other helminth diseases. To treat diseases, people also use the drugs we just mentioned above to treat diseases for their livestock. However, when treating, it is best for you to use injections, because using injections will ensure correct and sufficient dose of medication during treatment. In addition, you need to add supplements, vitamins, and take good care of their animals so they can recover quickly. People can refer to the treatment regimen as follows. Regimen 1. Inject Fluconix 340 at a dose of 1.5 milliliters per 50 kilograms of body weight. Combine with Dr.Vet 100 at dose 15 to 25 milliliters per head, or Introvit injection at dose 10 to 15 milliliters per head. Supplement Glucan C at a dose of 1 gram per 1 liter of water, or 10 grams per 5 kilograms of food to help increase resistance, fight depression, limit stress. Regimen 2. Intermectin super injection at a dose of 1 milliliter per 50 kilograms of body weight, combined with Butasyl 100 supplement at a dose of 5 to 25 milliliters per head, or Introvit injection at a dose of 10 to 15 milliliters per head. Supplement Glucan C at a dose of 1 gram per 1 liter of water, or 10 grams per 5 kilograms of food. Recently, we introduced to people fascioliasis in cattle and effective treatment regimens. Hope you have useful knowledge for your farming. Goodbye and see you again.